stop it, huh? There is some problem occurs in my laptop. So sterilization process. Good morning, everybody. Today we discuss about the
Good morning,
sterilization.
sir.
Good
Okay.
morning, sir.
Morning, sir.
Okay. So sterilization process. Last class we discussed about the introduction of microbiology and what are the importance and what are the microbes and what are the detrimental effect or pathogenic effect of the body by the microorganisms. So from save our life or save from microorganisms anything from your body or a material or some foods or some pharmaceutical products that must be sterilized. And sterilization one of the process by which it is totally free from microorganisms, and especially for the pharmaceutical purposes, for the medical purpose, and for the another purposes we can use this process to totally free from microorganism, because microorganism causes some diseases. So you can free from the microorganisms, that means you are not attacked by the microorganism, your product not attacked by the microorganism, so invasion of microorganism is so less. So we can try to remove the microorganism by this process is known as the sterilization. And sterilization is a totally absolute terms, it totally free from, that means 100% free from microorganisms. By this process it is called sterilization. It is totally absolute terms, not any compromisation. Suppose 99.99% is sterilized but 0.1% not sterilized, this is not true sterilization process, because 0.1% microorganism after 24 hours or 48 hours it will be 100% grow. So be careful in this sterilization, in any different types of sterilization. By this methodology you can use it, you must be 100% free, not 99.9% or less. 0.01 0 point fraction that will be created the contamination up to 100% within a 1 week or 24 hour, 1 day or 2 days. So be careful when a product will be sterilized, you can must know that it is sterile 100%, and it is sterile 100% or not, that will be checked by the another test, it is called the sterility test. But the previous process is known as the sterilization, and the different process are available to sterilize the pharmaceutical products, because suppose some basically for the parenteral products, those are directly introduced into the body by the intramuscular or intravenous or other route of administration. Another is the ophthalmic products, those are sterilized by this process before you administer. Another is the medical devices like pacemaker or other things, or in case of any surgical products that must be sterilized. So which product sterilized by the which process, you can know it and make a chartage from the day from today's, which product sterilized by the which method, and what are the mechanism behind this mechanism, and which mechanism, which method is applicable or not, and what are the advantage and disadvantage of this particular mechanism. So we thoroughly discuss about day by day, you can learn about this process sterilization. You can understand? Hello, are you
Yes, sir.
understand?
Yes,
Understood?
sir.
Okay, any question regarding this sterilization? The sterilization is the one of the important process
Sir,
by
একবার
which
স্টেরিলাইজেশনটা একবার রিপিট করবেন?
right, just you can write down. Sterilization is the process. Okay, you can see it. Sterilization is the process by which an article, surface or medium is made free of all microorganisms, either in the vegetative or in the spore form. So vegetative form or in the spore form, I think last class Manus told you what is the vegetative form of microorganism and what is the spore form of the microorganism. Any sort of microorganisms, either spore or the vegetative, that means their growth from. Okay, so these are the compound or vegetative microorganisms that will be free from any articles, that means any object, or in the surface. Suppose the floor cleaner you can use, suppose in case of operation theater, their floor, every wall must be free from microorganism, and that is the process of sterilization. And or the medium, suppose some media, the last class Manas sir told you that there is some culture media you can use. In case of culture media, that must be sterilized, otherwise it will be a lot of problem in case of culture of different pure culture or in the subculture of the microorganism. So sterilization, one of the most important process, and you can know it in your company. Suppose in parental section or any other section, or you can work in the medical devices. The sterilization is only one process you can know it, and you can save from the any article or surface or the mediums. Related another terms is the disinfection, another different process. Generally, in this process, the inanimate object can be sterilized by the process or remove the microorganism. That is called the disinfectant. And the destruction of all the pathogens or the organism capable of producing the infection, but not necessarily spore. So there is a difference between the sterilization and the disinfection. In case of sterilization, vegetative form of microorganism along with the spores, but in case of my disinfection, not included in the spores. So basically disinfection is used in case of inanimate object or in the non-living systems or in the floor or walls, that type of. So all the organism may not be killed, but the number is reduced to level the no longer harmful to the health. So that is called the disinfection. It is a floor cleaner, Lysol, Dettol. So these are the compounds which are used for disinfection. Okay, so this is the first time and last time we can accept it. The next day we cannot accept it for allowing in the class. So organism may not kill by the disinfectant. So sterilization is totally 100%, but disinfectant quite less. Another is the antiseptic. You are using some antiseptic, the chemical disinfectant which can be safely be applied to the living organisms and are used to prevent the infection by the living by inhibiting the growth of the microorganism. So in antiseptic used in for the living things also. Suppose boroplast, borolene, these are all the antiseptic or after solution which are used as antiseptic purposes, because they are used for living things only. Disinfectant used non-living things. And asepsis, the prevent the sepsis. This is the technique by which the occurrence of the infection into a uninfected tissue is prevented. It is called the asepsis. So you can know about what is sterilization, what are the advantage of sterilization, what are the different types of sterilization, and what are the mechanism of sterilization by which it will be sterile, and which process is applicable for a particular substances for sterilization. So it is very very important chapters. Not only this year, it will be helpful in your whole life. Even you can use in your life, daily life process. Suppose if one person will be cut, to how to sterilize the cut or wounds, so how to sterilize it, how to prevent the contamination of the microorganism. So there is a very practical oriented chapter as well as the theoretical base, and which chemical or which physical agent or another process we can use it to prevent or to eradicate the microorganisms. I think understood. Hello.
Yes, sir.
But
Yes,
what is the
sir.
difference between the sterilization, disinfection, and the antiseptics? Sterilization means the in all the purposes remove from 100% microorganisms, and disinfectants only used for inanimate object. That means non-living things like tiles, floor, operation theater. That will be by disinfectant. Even your home also, it will be everyday disinfectant by you can use which chemical? Phenyl. করে না বাড়িতে? Hello.
Yes, sir.
Yes, sir.
Phenyl, Dettol, Lysol. Actually, Dettol and Lysol are the two compounds which are coming from the same companies. Dettol, which contain phenyl, to phenyl, all if you know it. But Dettol, which chemical content? Do you anybody can tell? Dettol, because Dettol is a very good disinfectant and
Sir,
antiseptic property.
chloramphenicol.
না, chloramphenicol is a antibiotic. কি থাকে ওইরকমই নামটা। সো সো এখন থেকে দেখবে, হ্যাঁ
Chloroxylenol, sir.
হ্যাঁ chlorogynylenol, very good. Who tell me? Who tell it?
This was Tanzin, sir.
Okay, very good. Chlorogynylenol, which is present in 2 to 5%. This percentage also very important. Which percentage used as a anti disinfectant or sterilization or antiseptic? Chlorogynylenol and Lysol, the same company actually produced by the Dettol and Lysol, but Lysol used only by the floor, but and Dettol which are used in case of living things. But what are the use of Dettol? I think most of the people did not know. What are the, in case of suppose you cut in your hands or everything wounds, so what are the uses and what are the concentration you can use the Dettol? Anybody can tell?
Dilute, sir.
Directly, suppose one hands you cut by the sharp by the knives or a, so what are the concentration and what are the process, what type of concentration you can use for Dettol? কে বলতে পারে?
Dilute concentration.
Dilute, হ্যাঁ, which dilute মানে what types of মানে what are the ratio of the water and Dettol? Not কিন্তু raw Dettol you can never use in the cut, it will be aggravate the process, so you can dilute the Dettols. Write down this, okay? 1:40 ratio, 1:40, 1 drop of Dettol and 40 drops of water, sterile water, or 1 ml of Dettol and 40 ml of water, then you can use it. Okay, if you use some raw Dettol, it will be another the process, or it will be a sepsis. Okay, so you can know it, you can write down this 1:40 ratio. Be careful, I think most of the people cannot. When you cut it, generally they use some raw Dettols, but it will be process, this healing process is inhibitor, it will be healing process is will be delay. Okay, so another is the antiseptics we can use for after ablation or any type of sepsis. We can use Boropolas, Borolin, Borosoft, we are used as a antiseptic. And so what are the difference between the sterilization, antiseptic and disinfectant? Disinfectant used for inanimate object, antiseptic used for living systems, and then is the sepsis process. Next, why we need the sterilization? Obviously only one word answer: microorganisms capable of causing infection are constantly present in the external environment and on the human body, so microorganisms are responsible for contamination of the infection. So that will be, you can prevent the contamination. That is our main aim for sterilization. The aim of sterilization is to remove or destroy them from the material or from the surface. So this is the main motto of the sterilization, to remove or free from microorganism either from the articles or from the pharmaceutical products or from the surface. Right? What is the utility of the sterilization? Actually, suppose one product, or you administer one product, or maybe if you have some food. In case of food, there is no need of sterilization. Why? In case of injectable, any parenteral preparation, any ophthalmic preparation, any irrigational preparation, that any medical devices, that must be sterile before used. And before it, check it by sterility test, it is sterile or not. When it is sterile, that means it is not correct, it is sterile. It is sterile or not, that will be check it by the another test, sterility test. Okay, just you can sterile, it is sterile, this is not. Okay, so these are the process, these are the significance of sterilization. How can the microorganism can be killed or free from the articles? Number one, this process is very important. Number one, denaturation of protein. In your biochemistry, what is denaturation? That means Denatured means coagulation of the protein. If your protein or microorganism is coagulated, then means denatured. So their pathogenicity of the microorganism, this protein, will be lost. So ultimately, the organism cannot produce any infection. Number two, the interruption of a DNA synthesis or repair. Any by another process by which the microorganism can be stopped their growth or inhibited by the interruption of the DNA synthesis. Because the DNA or RNA or the nucleic acid, which is very essential for the growth, development and differentiation of the microorganism. So you can inhibit the synthesis of DNA. I think it will be inhibit the growth of the microorganism, and ultimately you can kill the microorganism. So another method by which or mechanism by which you can use the remove the microorganism or kill the microorganism. Number three, disruption of the cell membrane. Another most important methodology you can use, that's disruption of the cell membrane, because all the microorganism is encapsulated or covered by the some cell membrane, and it is a very good component. And what are the structure of the cell membrane? I think Manasya told you in future, what are the cell membrane structure of the bacteria, virus and the fungus. This is very important, because if you know the membrane structure of the microorganism and what are the chemical composition of the microorganism, that will be disrupt. That means immediately the organism will be killed. Suppose not only the microorganism, in case of suppose one person burn 90%, so that will be 99% chance to recover, do not recover this patient, because this outer covering is skin, it will be burned 90%, so infection will be automatically come. So there is a chance of death in case of 99%. So disruption of the cell membrane, that means all the component of the cell membrane will be lost and ruined or denatured. So disruption of the cell membrane, one of the most the category of the antibiotic which are used for disruption of the cell membrane, like penicillin and cephalosporin group of antibiotics. All the those are inhibit the cell wall synthesis inhibitors. Which group of antibiotics बोललाम? और beta lactam group of antibiotics like cephalosporin, penicillin. And under the penicillin, so many type of penicillin, amoxicillin, cloxacillin, decloxacillin, ampicillin, so many extended penicillin V, penicillin G, so many penicillin group of mane all are beta lactam group of antibiotic. Those are antibiotic which are in disrupt the cell membrane structure. Here also different process, physical or chemical agent to disruption of the cell membrane. Okay, so these are the three process by which you can destroy the microorganism. Which one? First one is the denaturation process. Next is the disruption of the DNA or nucleic acid synthesis, and number three is the disruption of the cell membrane. Okay, understood?
Yes, sir.
Yes, sir.
Okay. If any problem, please ask me, because it is a new chapter, new topic, new subject. But you know, the organism is so much harmful, so you can kill it. Therefore, suppose in this process, suppose you can develop a one process and this COVID coronavirus is killed, it should be a miracle. I think whole of the world thank to you. So you know, in case of sterilization, disinfectant in our Kolkata or in a city or in the village remote area, there is some chlorinated water is used for disinfection. কলকাতায় দেখবে যদি কেউ দেখে থাকো, কলকাতায় কারো বাড়ি হয় তাহলে দেখবে, বা যদি কেউ যাও তাহলে দেখে থাকবে, দেয়ার যে এভরি উইকস one machine, there a frog will be produced. It is a chlorinated water with sodium hypochlorite for germ killing property or to destroy the microorganisms in the environment. But this is not actually this process is occurred at a time in the whole of the world. I think it will be remove it, but it is not, it is quite impossible at a times whole of the world, that with this all the whole of the world can be sterilized at a glance. So if we use one locality, another the organism will be spread in the another locality. That's why it can be removed. So there is a time to time process and some. Next, what is the sterilization? You know it. And next, very careful, you know it. It will be help for not only this year, it will help for the every life if you stay in this profession. Okay. Number one, sterilization. Generally, it will be classified into a three groups. One is the mechanical method. Number two, physical method. And number three is the chemical method. The first one is the mechanical. We can discuss about the mechanical method. In this method, scrubbing, filtration, sedimentation, these are the three process by which the mechanical filter, in case of aquaguard, you can use some drinking water by the aquaguard or by the any water purifier by this filtration technology. Actually, one some filtration technology can use to destroy the or free from the microorganism. Sinter, basically the sinter glass filter or bacteria proof filter that will retain the microorganism, and another use some UV light that will kill the microorganism. So these are the mechanical process by which you can remove the microorganism. Another is the physical method. This is very important for our laboratory purpose as well as the medical devices or in the operation theater. Number one, moist heat. The moist heat, that moist heat, dry heat, sunlight, and the radiation. The moist heat, this is done by the basically by the autoclave, and discuss in the later on the elaborately. The moist heat, that means heat by the water and below temperature 100 degree by the pasteurization. The moist under the moist heat sterilization. One is the pasteurization, very very careful, important, and topics. Pasteurization, and above the temperature 100 degree, the steam under pressure, just like in the pressure cooker technology, you can use it basically for the basically less time consuming. But here is the main theme is the higher the temperature, the penetration power of the steam is very much high, and it will penetrate in the inside the microorganism and immediately coagulate the microorganism. So basically the moist sterilization by which is mechanism is the coagulation, heat coagulation method, by which the organism will be coagulated and the organism will be killed at high temperature. The coagulation is the high, so ultimately the organism protein structure will be lost, and ultimately their pathogenicity will be lost. And this in this method, generally the instrument used, write down this autoclave. Autoclave is the one of the different types of autoclave, like horizontal autoclave or in the vertical autoclaves. And autoclaves, just in our laboratory, just the 25 liters or 20 liters, this type of autoclaves. But in your company, 100 liters, just like a one room, one autoclave. So autoclave is the process, and all the surgical dressing, gloves, everything, instrument, all are sterilized by the autoclave. So moist is one of the most important technology or technique by which sterilization of the microorganism. In case of pharmaceutical product, in case of medical devices also, or surgical apparatus, gloves, rubber gloves, surgical dressing, scissors, all these material, plastic material, they just sterilized by the some way, but sometimes the plastic material by the gaseous sterilization, ethylene oxides. And in case of dry heat sterilization, hot air oven is the one of the most important instrument. Use hot air oven 160 degree centigrade temperature for 2 hours. 160 degree temperature. In case of autoclave, 121 degree centigrade temperature for 30 minutes for 15 pound pressure. Number one, hot air oven. Number two, insertion, flaming, sunlight, low temperature, red heat, and infrared. By this technology, you can use the dry heat. So we can details discuss about the different types of dry heat process, like hot air oven, what is insertion, what is flaming, what is sunlight. Sunlight is the one of the most important. It is a free sterilization method because sunlight produce some UV ray. That UV ray kill the microorganism. In case of the sweet soap, there is some sun UV light. To in case of water purified, there is some UV light. That UV light kill the microorganism. But simultaneously, UV light is harmful to the human. So be careful. It is not exposure to the human. And low temperature Sterilization by the low temperature, how it is possible, or red heat. Obviously, in case of red heat, in case of culture preparation of culture media, in case of practical microbiology, you can the microbes loops or red heat to kill the micro, to sterilize the loop, or infrared, that will be also in remove the microorganism or kill the microorganism. Next is the sunlight, the natural process by which the microorganism can be killed by use some UV light. Another is the radiation. It is the most costlier but most effective treatment based for sterilization, but it is very costlier process by which you can, no other process is not, when radiation is applied, when the no other process is not applicable. Suppose one compound which is thermostable and which is another is the thermolabile. Which is thermostable? Those compounds which are sterilized in presence of heat. But some substances, suppose vaccine, sera, all the proteinous substances, enzymes, which are thermolabile substances. Because in presence of heat, either autoclave or by the hot air oven, this protein, vaccine, sera, antitoxin, toxoid, that will be destroyed. These are lost their property. They are lost their biochemical property. So in that case, you must use the radiation technique, or commonly known as the, write down this, another name of the radiation is they call cold sterilization method. What is the name of the? It is the cold sterilization. Generally, where our common concept, the sterilization means you use some heat, but radiation is the one of the technique you use, not use any heat, but the microorganism will be killed. So radiation is the two types. One is the non-ionizing radiation, another is the ionizing radiation. Non-ionizing radiation means UV light. UV light, there is no heat or temperature. This UV light can penetrate inside the microorganism and kill the microorganism. Another is ionizing radiation, X-ray and the gamma ray. So ionizing radiation is most important mechanism by which the microorganism will be killed, or sterilization is a process, but it will be sometimes effect on the host cell also. Suppose you are X-ray for the bone of your hands or legs. So if you needed, if you go through the X-ray, if you not needed, your doctor not suggested it, then you cannot use for the X-ray, because X-ray also effect on your host cell, that means human cell also, X-ray and gamma ray, because gamma ray is a very good penetration power, so your cell will be destroyed due to presence of gamma ray. So be careful. In case of non-ionizing radiation, X-ray or gamma ray, it is not used frequently. If it is necessary, then you can use it. Okay, I can remember it. I think all of you remember it. Okay, X-ray or gamma ray.
Yes, sir.
Be careful, huh? Be
Yes.
careful. Unnecessary কখনো X-ray করতে যাবে না, because this X-ray or gamma ray, it is a ionizing radiation. Sometimes your cell may be destroyed, and this cell after some times or a years it produces some cancer cell. So be careful about the X-ray or the gamma ray. And another the radiation. Radiation means radioactive substances. I think most of this information all of you know it, but in case of X-ray and gamma ray আমরা কিন্তু কথায় কথায় চলে যাই যে কিছু একটা হলো X-ray করে নিয়ে আসি, কিছু না, this X-ray will sometimes damage your host cell. Another is the liquid chemical method. Generally in this case, the liquid like alcohol, aldehyde, heavy metals, dye, lysol, halogens, gaseous agent, and formaldehyde and ethylene oxide. Ethylene oxide actually gaseous technique. One is the most important. Ethylene oxide is a gas which is very good penetration power to the microorganism and ultimately kill the microorganism. This is the class of chemical agent, but sometimes some are liquid and some are gas. That is the chemical agent, liquid and gas, but the process is combinedly known as the chemical method of sterilization. So I think all of you understood what is the classification of sterilization, and what are the method, what are the instrument, what are the use, and what are the advantage and disadvantage details in later class. Okay, next I go through the next slide. Any question?
No, sir.
No, sir.
If you not understood, please ask me any sort of question, huh? Because it is a very good flowchart you can remember in your mind just as a picturization. What are the type of sterilization, what is sterilization, how to sterilize, and what are the mechanism, and which mechanism is better. Later we discuss with you. Okay, any question? সবাই বুঝতে পেরে যাচ্ছে?
No, sir.
If you are understood or I am better understood? আমার শরীরটা ভালো না। নেক্সট বলো, নেক্সট চলো, physical method of sterilization. Today I discuss only one method. What is the physical method of sterilization under the first class? देखो, first mechanical and then is the physical. So I discuss with the physical method. First, the heat sterilization. Another is the filtration. This is under the class of mechanical, and is the ultrasound wave. This is the most advanced technology can use for sterilization. And in case of physical, one is the dry heat, another is the moisture sterilization. In case of moisture sterilization, at temperature below 100 degree, that is called the pasteurization. Generally milk powder are sterilized by this below 100 degree, or it is called pasteurization, or sometimes it is called the tindelization. So what is the pasteurization and what is tindelization, we can discuss later on. So at a temperature, first, in case of moisture sterilization, at temperature below 100 degree, at a temperature below 100 degree, or a temperature above the 100 degree, and that will be done by the autoclave. In case of dry heat sterilization like red heat, by flaming, direct flaming করে আমরা করতে পারি, যে কোনো জিনিস দ্বারা পুড়িয়ে দিলে তাহলে that will be যখন previously when the disposable syringe is not come, at that time the needle was sterilized by the flaming, just flaming, or use some alcohol, ethyl alcohol, or rectified spirit. But nowadays disposable syringes come, that's why one person can use it, then it will be remove it. So another is the dry heat sterilization, or red heat, or flaming, or insertion, or infrared radiation, and hot air oven. This is the instrument for hot air oven. This is UV light, this is ultrasonic sound, and this is the filtration technology, and this is the Bunsen burner used for flaming, and another is the sunlight. So these are the process you can use, these are the process, these are the instrument. With the help of this you can use the physical sterilization method. Another is the filtration. It is a very common technique by which you can use some filter paper for mechanical barrier, the filtration of some liquids, or filtration sometimes gases. Filtration of liquids in case of sinter glass filter, or water bacteria proof filter. Your suppose water filter in use, there is some filter that can prevent or guard against the bacteria or the viruses also. Or in case of ordinary filter, there is a sintered glass filter can prevent the or guard against the bacteria also. Another filtration by the gas. In case of HEPA filter, HEPA filter for use for HEPA is used for aseptic chamber. In case of parenteral preparation, in the aseptic chamber. So which is the aseptic chamber, and what are the criteria of the aseptic chamber? And I think it will be discussed, it will be discussed by Manoj sir, or it will be not discussed, then you can ask me, I told you. Okay, so in case of aseptic chamber, what is the aseptic chamber? Now where the parenteral preparation is produced, their raw material to final product, all this process which is occur under the aseptic condition. So in this aseptic condition, there is some use some filters, it is called HEPA filter, HEPA, HEPA. Have you heard the terms? Hear the terms HEPA?
No, sir.
No sir. You can write down HEPA filter used for sterilization of gas. Mane HEPA, write down HEPA, HEPA. HEPA for likho high efficiency particulate air, high efficiency particulate air. But because in case of aseptic chamber, or aseptic room, or aseptic surroundings, that will be air must be filtered by the HEPA, because air if is contaminated, then all these process will be decontaminated. So your gas or air must be filtered by the HEPA, high efficiency particulate air. Complete লিখেছো?
Yes, sir. Done.
Done. Okay. Very good. Next, the irradiation or irradiation, or that is I is mistake. Radiation technique. One is the ultraviolet ray, non-ionizing radiation, and another is the ionizing radiation. On the ultraviolet ray is a non-ionizing, and X-ray and gamma ray is the ionizing radiation. Next is the sound. A ultrasonic sound that must be kill the microorganism also. Even you can remove the mosquito by using some ultrasonic sound wave, and sometimes pressure, the Pasteurization, you can use some pressure, and sunlight, the solar is used as a disinfectant, especially by the use of UV ray, which is emits from the sunlight. That UV ray used as a disinfectant. Okay. Next, the classification of sterilization method. Physical method: heat by dry heat, only the heat, dry heat or the moist heat. Radiation and filtration, and chemical use for alcohol or aldehyde, phenol, halogen, oxidizing agent or salt, and surface active agent, ethylene oxide gases, dyes and vapor phase for disinfectant. Okay, so the kota time ache. Next class, what the time?
11:50, sir.
11:50.
11:50, sir.
11
11:50, sir. 50.
11:50.
Yes, sir.
Okay. So in case of physical sterilization, number one, the heat is the important factor that can help for the dry heat or the moist heat, but heat is the parameter that you can apply it and sterilize or kill the microorganism by any means, either by coagulation or by inhibit the DNA synthesis or by any process. Okay. So factors that influence the efficacy of the disinfectant and the sterilization. Which factors? Contact time. Number one is the contact time. If the contact time is high, the sterilization will be high. Right? Suppose you can touch it. Suppose you can some article you placed in the heat for a moment of second. That will not be sterilized. Or some compound which is sterilized by the autoclave. If it's some time, generally the 30 minutes and 15 NB pressure, but you can less time, through 1 minute you can heat it, there is no chance of sterilization. So contact time is a very important parameters that will be effect on the sterilization. If a proper guideline, as per the guideline, you can follow it either in the moist heat or by the dry heat, the time must be maintained. In the hot air oven, the 2 hours is required for sterilization, complete sterilization. In case of autoclaves, 30 minutes is at least 30 minutes. But if your temperature rises or pressure rises, in case of the temperature will be less. So at least 15 minutes is required for autoclave, for quantum. So contact time is the one of the most important parameter to remove the microorganism or kill the microorganism. Clear? Understood?
Yes, sir.
Yes,
Okay.
sir.
Another physico-chemical environment where the sterilization process occur. As for example, pH. pH is the one of the most important factors. Suppose one organism, it will be survive in a certain pH. You can change the pH due to some addition of heat or salt or any other means. That physico-chemical changes that environment, that microorganism can be affected and the microorganism will be killed. What is pH? Who said this? Anybody can tell? What is pH? This is very
So log
important.
is 10.
Bolo. What is pH? What is pH? The pH bolo tatali. This is very important. Blood pH koto. What is the pH of blood?
7.3, sir.
7.3. Actually 7.4. Actually the pH of the blood is the 7.35 to 7.45 and the average is the 7.4. When you ask a question, what is the pH of blood, always you tell that 7.4, not 7.35. Range ta bolte paro, it is better 7.35 to 7.45, but there it is 7.4 because blood, this pH of the blood 7.4 is a buffer. It is maintained by the 3 buffering system. So that's why it cannot be changed the pH. If it is changed, and I think it will be told you this, জানি না তোমাদেরকে বলেছি কিনা, যে if we change it just 7.4, it will be exceed just 7.8. Systemic blood মানে blood pH change just above the 7.8, the man can be die, or the pH below 6.8, the man will be die, man or woman both. So be careful. If a systemic acidosis or systemic alkalosis, if the blood pH change above the 7.8 or below the 6.8, the man or human being will be die. That's why the pH of the blood 7.4 is constant, remain constant by using some buffer. So in our nature, thank God to God যে কিভাবে সিস্টেমটাকে ডিজাইন করা হয়েছে, that must be maintain the pH 7.4. and which buffer system for maintain the pH? either নাহলে otherwise যে কোনো লোক যে কোনো সময় ডেথ হতে পারে, because change is very negligible. দেখো 7.4 is rise to 7.8, তুমি কিছু বুঝতে পারবে না, but it is never change if any serious type of problems. Okay, so one of the 3 buffering agent in our system that can maintain the resistant the change of the pH, that's why it is called the buffer or buffer solution buffering agent. One is which buffer? In case of pathophysiology, physiology, I think you can understand. Which buffer?
Isotonic.
which buffer? ঘুমিয়ে পড়েছে নাকি সব কটা? একবার দেখি। Hello, you can remember it whole of the life. What is the pH of the blood? Not only pH of the blood, very common organ like gastric juice, লিখে রাখো, gastric juice, skin, urinary system, urine, তারপর হচ্ছে eye, gastric juice, different মানে gastrointestinal tract, different area. What are the pH? It is very important, because if you know the physiological condition of the human system, you can use a proper drug. Otherwise, the wrong choice of the drug. I think next day you can remember it. Suppose you are hyperacidity, that means your pH, gastric pH ki low or high? Hello, suppose you are suffering from hyperacidity, that means ki your pH of the gastric juice is low or high?
Low.
Low, sir.
Low, sir.
Normally
Low,
the very good. Normally the pH of stomach is কত জানো? স্টমাকের পিএইচ কত? স্যালাইভার পিএইচ কত? সো এই পোর্শন গুলো কিন্তু ইউ ক্যান মাস্ট বি নো এভরিথিং, না হলে আদারওয়াইজ ইউ ক্যান নট ডিজাইন এ নিউ ড্রাগস. সো 1.5 to 2 is the gastric pH of stomach. After that the pH will be rises, and in the intestine the pH is the basic pH. So your pH, stomach pH is the 1.5 to 2 or maximum 3. But when hyperacidity, their pH is below 1. So in that case, how it will be treated? What are the medicine you will take? Antacid. Hello?
Yes, sir.
Yes, sir.
So you know it, your pH will be changed. So how to control or how to change the pH? Only antacid can use. But sometimes antacid ki kore? To neutralize the acidity. So increase the pH, lower pH হয়ে যাচ্ছে, it will be aggravate or increase by using some antacid. So antacid is the main preferably choice for hyperacidity, but generally most of the people not use antacid. So now এখন তোমার acidity হলো, you go to the doctor or you use some medicine. Which medicine you take? Which medicine? Which medicine?
Prazole.
Huh?
Pendi or pantoprazole.
Pendi or pantoprazole. Very good. Because pendi pantoprazole. But I telling you, ekhuni bollam je when hyperacidity, antacid is the most appropriate drug. But you use omeprazole, pendi or pantoprazole. Actually, in this group, so many drugs: omeprazole, pantoprazole, rabiprazole, lisinoprazole. So many groups of. But it is a higher version of this group of. Generally, this acidity can be treated by the 3 types of substance. Number 1 is the antacid, one is the systemic antacid, another is the non-systemic antacid. Another H2 blocker that can prevent the HCl secretion, like ranitidine, cimetidine, loratadine. These are the drugs for use for the H2 blocker to prevent the secretion of HCl, because acidity due to HCl, and HCl secreted from where? In the inner lining of the stomach. And which cell secrete the HCl? Anybody can tell? Which cell? So we know about which cell secrete the HCl, when it will be secreted, in which environment or in which condition the HCl secretion will be high or low. That is, in your chemistry it is called hyperchlorhydria or hypochlorhydria. In case of pharmacology it is called hyperacidity. So condition is the same, but the pathophysiology or physiology also same. Which cell secrete, when it is secret, and how to treat it. Okay, which cell? Anybody can tell?
Sir, parietal cell.
Parietal cell.
So the only parietal cell? No.
Parietal cell, so gastric mucosa.
গ্যাস্ট্রিক মিউকাসা তো লাইনিংটা, এছাড়াও another 2 cell, 3 cell responsible for HCl. One is the parietal cell, another chief cell, another oxyantic cell. These 3 cells are responsible for HCl. HCl, Cl is common and H is a proton and Cl is the anion, তাই তো? H হচ্ছে proton and Cl হচ্ছে minus. So in this class, so Cl, HCl is combined the Cl from the sodium chloride, and H will be come from water or any other compound. So ultimately HCl will be released from chief cell, parietal cell or oxyantic cell by the stimulation of other environment or by the some agents. Suppose তুমি কোনো food poisoning এর জন্য হতে পারে, সাপোজ কোনো হাই রিচ ফুড খাওয়ার জন্য হতে পারে, বাট হোয়াট দ্য কজ সেটা যাই হোক, বাট ইউর HCl level is the high, so your pH will be low. At that condition you must maintain your pH. So antacid is the first choice of drug, but most of the people or candidate, those are literate or those are illiterate. Doctor always advise either র্যান্টেক এখন একটা অন্য কারণের জন্য ব্যান্ড হয়ে গেছে, সেই জন্য র্যান্টেকটা লিখছে না, কারণ র্যান্টেক প্রডিউস ক্যান্সার। দেখা গিয়েছে এতদিন র্যান্টেক ইউজ করতে প্রচুর, এবং এই গ্রুপের ফার্স্ট ড্রাগ ছিল সিমেট্রিডিন, বাট র্যান্টেক, জেনটেক, ফিমটেক দিজ আর অল অ্যাভয়েড করে এখন সবাই আইদার ওমিপ্রাজল অর না হলে প্যান্টাপ্রাজল অ্যালং উইথ দ্য প্যান্টাপ্রাজল প্যান ডি অর প্যান ডি, দ্যাট মিনস প্যান্টাপ্রাজল অ্যালং উইথ দ্য ডি মিনস হোয়াট ইজ দ্য ফুল ডি? ডির মধ্যে কি থাকে জানো? ডোমপিরিডন। It produce, it inhibit the gastric মানে gastric irritation, মানে গ্যাস যে গ্যাস ফরমেশন হয়, that will be inhibited by the domperidone. That's why two combination is very much applicable, but actually preferred drug হচ্ছে antacid, because your acidity many discomfort due to your hyperacidity. So you can change your pH, an acidic pH lower, there are below 1, that will be changed by antacid. You can use simply antacid. And which type of? Non-systemic antacid. Never use systemic antacid. What is systemic antacid? Those are systemic change. Systemic blood pH will be changed. That's why it is called systemic antacid. And these are not system. Only localized pH will be changed. That is called the non-systemic antacid. And which one the give one example of systemic and non-systemic antacid? Give a sodium bicarbonate, only one. It is a systemic antacid. And except sodium bicarbonate, calcium carbonate, magnesium trisilicate, all are the non-systemic antacid, along with the aluminum hydroxide gel, magnesium hydroxide. Sometimes generally antacid are used, a ideal antacid which are prepared by the combination either aluminum along with the magnesium salt. So these are the non-systemic antacid. This non-systemic antacid, any sort of problem, not create any sort of problem in case of systemic pH. But the systemic antacid, sodium bicarbonate, it is very dangerous for change of the systemic pH. So that's why I request you, all of the student, not only student, this information given to the other person, society low people, or basically the poor people. When the acidity, they much more taking the sodium bicarbonate, or simply the খাওয়ার সোডা যেটা আমরা বলে থাকি, this sodium bicarbonate they can use. Even the literate person, even you also, they take, when acidity, they take the cold drinks, and cold drinks contain here is a specialized sodium bicarbonate. This sodium bicarbonate, actually the sodium bicarbonate along with the HCl, they produce sodium chloride along with the carbon dioxide. So ultimately immediately you can relieve when you take sodium bicarbonate. But this sodium bicarbonate never you can use. The sodium bicarbonate initially reduce the HCl and they produce carbon dioxide, but this carbon dioxide again react with the, after sometimes again react with the water, they produce some carbonic acid, CO2 plus H2O, ultimately H2CO3 carbonic acid. So again the acidity will become, so that is called the rebound acidity. So you can prevent it. So never use sodium bicarbonate used as a antacid, because it is very not effect on the, initially it helpful, but after that it will produce some acidity, and this is called the rebound acidity. And this term you can never forget it, and you can remember what is never rebound acidity, what is achlorhydria, what is hyperchlorhydria, what is hyperacidity, hyperacidity. So today we discuss about microbiology. We started the microbiology, but you can correlate with the different subject also, physiology, pharmacology, chemistry. Okay, I think it will be very good knowledge and very appropriate choice of the drugs. সেই জন্য বললাম তাহলে সোডিয়াম বাইকার্বনেট খাবে না, অনলি নন সিস্টেমিক অ্যান্টাসিড ইউজ করবে। আর যেটা প্যান্টাপ্রাজল, আমি যদি সেটাও কখনো ইউজ করবে না, কারণ দে আর ইউজ it is broad spectrum. When you use omeprazole, the 24 hours it block that particular receptor, so normal physiology will be changes. In case of pantoprazole or domperidone, unnecessary দরকার নেই। যদি কখনো দেখা যায় যাদের chronic, in that case, in case of acute acid, there is a no need of pantoprazole, no expenditure, money also excess than the antacid. Antacid 1 টাকা দাম, ₹1, but pantoprazole sometimes 7 to 9 rupees cost. So why you can use only the antacid if it is a acute hyperacidity, মানে হঠাৎ যদি হয়, but it is a chronic hyperacidity, they are suffering with the hyperacidity month of month. In this case you can use the such type of drugs. In that case antacid are not used. Okay, so you can know about thorough about
Okay,
this,
sir.
okay, I think understood all of you.
Yes,
So
sir.
you can,
Yes, sir.
সেই জন্য দেখো নোট আমি স্টার্ট করেছিলাম, আই স্টার্টেড বাই সাবজেক্ট এজ এ মাইক্রোবায়োলজি. দিস টপিক goes to penetrate the touch all the subject: pharmacology, physiology, pathophysiology, chemistry and pharmaceutics also, hot formulation. এবারে দেখবো এবারে কোন টাইপ, যদি বলে ট্যাবলেট, ধরো সিস্টেমিক or নন সিস্টেমিক, ট্যাবলেট ইউজ করব না কি বললেন গ্র্যানুলস ইউজ করব, না উই আর ইউজিং সাম এফারভেসিয়েন্ট, কারণ এদিকে ইনো দেখবে ইনো খেলে অনেক তাড়াতাড়ি হয়, কারণ কি দে আর ইউজ সাম এফারভেসেন্ট, দেখবে খুব তাড়াতাড়ি র্যাপিড অ্যাকশন হবে, বিকজ দে আর প্রডিউস দেয়ার সারফেস।
But sir, it affect on heart instance also.
হ্যাঁ হ্যাঁ, so that's why in case of যাদের হার্টের প্রবলেম থাকবে সেই ক্ষেত্রে we cannot use, but which is the preferable drug, I think if you know thoroughly and pharmacist is the right person to choose a appropriate drug for appropriate patient. Okay, है ना?
Yes sir.
Yes sir. Yes sir.
It is believe or not, যদি if you know it everything, the pathophysiology, the physiology, biochemistry and formulation, কারণ because you are the masterpiece of medicine. এখন হয়তো তোমার ফার্মাকোলজি শুরু হয়নি, জাস্ট আমি নামগুলো বলছি, বাট দিস ইজ এ ভেরি কমন নেম, দ্যাটস ওয়াই আই এক্সাম্পলিফাই দে ভেরি omeprazole, I think all of you know it, name মানে, but what is omeprazole, what is the function, what is the structure and what is the mechanism action, I can remember it, I can just highlight it you can next semester, I think it will be helpful for you. Okay. Okay. Next day we can start again from the sterilization by dry heat and next by the moisture sterilization. Okay.
Okay sir. Okay sir. Thank you sir.
Thank you sir.
I think understood all of you.
Yes sir. Understood.
Microbiology কেমন লাগছে?
Understand. ভালোই
কেমন
স্যার।
লাগছে বলো, বুঝাতে
ভালোই
পারলাম?
ভালো, ইন্টারেস্টিং।
যদি আমার কিন্তু শরীর খারাপ, জ্বর আছে, গায়ে হাই টেম্পারেচার, তার সত্ত্বেও তো যেহেতু লাস্টে আমি নেবো বলেছিলাম, মানে যদি না হলে আমি তোমাকে পরের দিন নেবো, যদি কোনোদিন এরকম সমস্যায় পড়ি, আজকে শরীর খারাপ, প্রচন্ড শরীর খারাপ আছে। ওকে, সো প্লিজ you give me your comments in the comment section, 1 or 2 words for feelings about this microbiology. Okay, just you can comments on this comment. Okay.
Okay sir.
Just 1 or 2 words you can write down. হ্যাঁ, ক্লাসটা কেমন লাগছে তোমার, এই না রোল নাম্বার না।
Sir, in this meeting comment box or in WhatsApp?
না না না, এখানে এটাইতে।
ওকে স্যার, ওকে স্যার,
এখানেই লিখে দাও, এখানে ক্লাস শেষ, এখানেই কমেন্ট শেষ। যদি যা ভালো লাগবে সেটা বলবে, যদি খারাপ লাগে সেটাও বলবে, ইউ ক্যান কমেন্ট, তাহলে আমি সেটা বেটার ওয়েতে আরো বোঝানোর চেষ্টা করব। or any sort of problem you can feel any sort of problem, please comment in my comment box, মানে এই চ্যাট বক্সের মধ্যেই লিখে দে, সেটা আমি দেখবো, দেখে তারপরে আমি নিজেকে মডিফাই করব, তাই না? বিকজ তোমাদের ক্লাসটা করার জন্য যে আমার মোটিভেশনে থাকে, আমার ক্লাস নেওয়ার জন্য মোটিভেশন লাগে, বিকজ ইউ আর মাই মোটিভেটার, ইউ আর মাই স্টিমুলেটার। তুমি যদি আমাকে স্টিমুলেট করতে পারো তাহলে আমি তোমাকে আরো বেটার হইতে দেবো, তাই না? লিখছেন কেন, বাকিগুলো লিখে না কেন? আদার স্টুডেন্টস, হোয়াই নট এনি কমেন্টস? If you correlate between the different subjects, I think you have very good knowledge. I mean very মানে কনফিডেন্ট ফার্মাসিস্ট হতে গেলে তোমাকে এই জিনিসটা করতে হবে, নাহলে তুমি শুধু একটা ধরে সাবজেক্ট পড়লে হবে না। one compound, what are the pharmaceutics, what are the behind the microbiology, what are the pharmacology, what are the chemistry, what are the others. So all these subject you can comment it, I think it will be helpful to you. Okay.
Okay sir.
তন্ময়,
থ্যাংক ইউ স্যার।
না কি বলে তন্ময়, কি বলছে? ওকে তন্ময়, স্ট্যাঞ্জিন?
হ্যাঁ স্যার ভালো।
হ্যালো স্ট্যাঞ্জিন।
স্যার ভালোই।
ভালো। হ্যাঁ, what feeling about this class, today's class? হ্যাঁ, হ্যালো।
Yes sir.
Okay. Are you know the স্ট্যাঞ্জিন, তন্ময়?
হ্যাঁ স্যার অবশ্যই ভালো লাগছে ব্যাপারগুলো কনসেপচুয়ালি।
হ্যাঁ, কনসেপ্টটাই তো আসল, এটা তো বাকিটা তো বই পড়ে। হ্যাঁ, বইয়ের জন্য থেকে স্যার নিশ্চয়ই বলেছে এনকে জয়েন পড়তে পারো, পেলজার পড়তে পারো, এনি হট এভার, এনি মাইক্রোবায়োলজি বুকস, ওকে, মেডিকেল মাইক্রোবায়োলজি, এনি সর্ট অফ বুক। যদি বই দরকার লাগে আমাকে বলবে, যদি কোনো বই না পাও আমি গুগলে ক্লাসরুমে আপলোড করে দেবো, কোড তো দিয়ে দিয়েছি। বাট
স্যার আপনি যেটা দিয়েছেন না যে স্টেরিলাইজেশনটা, ওইটা স্যার পিডিএফটা খুলছে না, মানে চেক করছিলাম পিডিএফটা। না
স্যার
খুলছে না।
আসলে স্যার ড্রাইভটা আপনি যখন পাঠিয়েছেন ওটা স্যার ওপেন টু অল করে মানে করলে ওটা সবাই দেখতে পেত। ওটা
হ্যাঁ
স্যার
স্যার, ওটা
আপনাকে একটু
আমি
অলও করতে হবে।
ও মানে
হ্যাঁ
ওটা
রেস্ট্রিকশন
আপনি
মানে সেটিংস এ প্রবলেম
হ্যাঁ
আছে।
রেস্ট্রিক্ট মুড
হ্যাঁ
করা
স্যার,
আছে,
হ্যাঁ
ওটা
স্যার,
রেস্ট্রিকশন অলও
একদমই
করে
তাই।
দিলে তখন আমরা সবাই দেখতে
আচ্ছা
পাবো।
আচ্ছা ঠিক আছে, ওটা
আমাদের
করে
কাছে শো
দিচ্ছি।
করছে না স্যার।
দেখো ওখানে একটা আমি পিডিএফ দিয়েছি, কিন্তু পড়াচ্ছি আর একটা, মানে যাতে তোমাদের নলেজটা বেটার হয়।
হ্যাঁ স্যার,
ওখানে একটা দেখো
বাট
ইনফরমেশন দিয়েছি, আর এখানে কিন্তু আমি শেয়ার করছি
হ্যাঁ হ্যাঁ
ডিফারেন্ট পিডিএফ, ঠিক আছে? বাট you know about the what is sterilization.
Sorry to interrupt, sir. Bonisika gave the link and told us to join in the 11:50.
ও ঠিক আছে ঠিক আছে, বর্ণিশিকা বলবে, দিবক স্যার নিয়েছিল, বলে দেবে, ঠিক আছে? ওকে
Okay, sir.
ওকে, থ্যাংক ইউ অল অফ ইউ।
থ্যাংক ইউ
Nice.
স্যার।
And sir it will helpful us it will this post in this classroom also this pivot.
হ্যাঁ হ্যালো, বলো বলো, বাংলায় বলো, কি
This
বলছো?
sir this PDF if you also post it in classroom that is helpful to us.
দিস পিপিএ, ওকে 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 ওকে, আই ক্যান পোস্ট ইউ। হ্যাঁ,
Sir,
অ্যাকচুয়ালি ল্যাপটপটা একটু
yes,
প্রবলেম করছে, তার জন্য আমি কিছু করতেও পারছি না, কোনো ভয়ে
ওকে
ভয়ে
স্যার,
ছিলাম যে আজকে শেষ পর্যন্ত ক্লাস হবে কিনা। ওকে
ওকে স্যার,
okay
ঠিক
sir.
আছে, ইউ ক্যান লিভ নাও।
Good.
ওকে
থ্যাংক ইউ স্যার।
ওকে, থ্যাংক ইউ ভেরি মাচ
Okay,
ফর
thank
অল
you
অফ ইউ।
Thank you, sir.
ওকে
থ্যাংক ইউ স্যার।
ওকে।